be one of the nurses taking care of you today. What's your name?
Hi, my name's Mike and Ike.
That's an interesting name. How'd you get that name?
Well, my grandma gave it to me because it was her favorite candy.
All right. Well, what can I do for you? What brought you in to see us today?
Well, so usually I have like a ton of energy and I like do a bunch of things and I have all these friends and we're like super active, and lately I've been so tired. Like can hardly get out of bed, and just like really my activities of daily living are not normal. And it's just not normal for me.
Anything? Have you noticed any other symptoms with, your appetite or stomach problems or breathing? Anything?
Well, my breathing's okay, but I usually drink like water normally, but lately I've had to drink like 20 of these a day, and I just cannot quench my thirst. And I have been peeing all of the time. Like every 5 minutes I have to go to the bathroom. And it's just not good.
As it is a little bit excessive as far as the water intake. Anything as far as your appetite that you've noticed that's different? Are you eating normally?
Oh my God, so much. And look at me, I'm like wasting away. I lost like 20 pounds in the past month. My grandma had diabetes.
Grandma got run over by a reindeer.
And I'm really scared because she lost her leg and it was really sad. And I don't know what I'm gonna do.
Well, we will check it out and see what's going on. Do you have any other medical issues that you're treated for or take medicine for on a regular basis?
No, you know what? I'm just like super healthy.
Okay.
Like really healthy all the time.
All right, that sounds good. That should be pretty simple then. We'll probably do some labs since you have a family history of diabetes.
Okay.
And get a urine sample and
Oh, good,
check
because
it out.
I like really have to pee right now.
Then when you go in the bathroom, there's specimen cups already in there, and then we'll have the nurse draw some blood when you come out of the bathroom, and then we'll go from there.
So I pee in the toilet?
No, in the specimen cup.
Okay.
And then you leave the cup in the bathroom for the nurse.
Okay.
Okay.
Okay, I'll be right back.
Hello, come in.
Hi, Dr. Hugh. I wanted to talk to you about one.
It's actually Dr. Hugh Malong. Sorry.
Sorry, stand corrected. I wanted to talk to you about the new patient that just came in.
Okay.
In room 3, she's a 27-year-old female presenting with the 3 Ps and sudden weight loss in the last month.
Sorry, I have so much patience, but you said room number 3?
Yes,
And the last name is
Ike.
Ike. Okay, Miss Mike and Ike.
Yes, Miss
Okay,
Mike and Ike.
Mike and Ike.
Yes.
Go for it.
So in addition to the sudden onset of the 3 Ps and the weight loss in the last 30 days, she also has a family history of a grandmother who passed away with complications from type 1 diabetes.
Okay, well, I haven't even had time to stop by her room yet, so my plan of care for right now, I could just say order a full blood panel, get your CBC, CNP, A1C, FPG, OGTT, maybe some CAT scans or MRI. Not
Okay.
too sure right now.
Alright.
They just.
Is that what you want? Would you like me to put an order in for those?
I'll put in the order for that, but just right now.
How about a UA?
Yeah, UA sounds good.
Okay, that's perfect, because she went into the bathroom. I had to go ahead and leave
Good,
this one
so
just
you-
in case.
You're doing your job, okay. That's good. That's helping me out. Well, I'll just let her know I'll come in and see her in the next 3 hours or 4. Whenever I get a chance. Right now it's slammed.
All right.
I don't know. Maybe I can fit her in seeing her today. Is there anything else that you needed?
No, that's
I mean,
it.
next time you could just give me a phone call or just send me an email.
Well, I don't want to take up too much of your time.
Well, okay.
All right, well, thanks very much for your help.
Hello, ma'am. How are you doing? What's your name?
Mike and Ike?
Ike? Do you like to call Miss Ike or Mike and Ike?
Mike and Ike. please.
Mike and Ike.
Grandma.
Okay.
It's for Grandma.
Well, Mike and Ike, I was able to fit some time in my schedule, and it looks like you do have diabetes type 1.
Oh my God!
Well,
Doctor!
it's alright.
Grandma died of diabetes. Am I gonna die?
I'm sorry to hear that, but I actually have to go talk to another patient right now.
Well, what am I supposed to do?
Well, you can just sit in your chair for right now, and then maybe the nurse will come by and talk to you.
You are the worst doctor ever.
Have a good day.
Mike and Ike, what's going on? What happened?
Stupid Dr. Hume Balls.
So what did he say?
He just came in here and was like, whatever, Mike and Ike, I don't even know your name, but you have diabetes. And Grandma died of diabetes, and what am I gonna do? Am I gonna die? He was just like, I have to see other patients because I don't care about you.
Okay, here's first things first. We're gonna teach you how to handle this disease, okay? You're gonna manage your sugar, you're gonna manage your insulin, and you will be just fine. You'll be able to have the activities and live your life the way you want to, okay?
Okay, because Grandma lost her foot. Am I gonna lose my foot?
That is a possible complication, but if you manage everything really well, that should not happen to you.
And you guys are gonna teach me how to do that?
We are gonna teach you. The nurses in this office go through a specialized training program, and we're gonna have you watch a little video to educate you about all kinds of stuff, and then we'll come back in a little bit and we'll discuss it. Sound good?
Okay.
Okay?
Okay.
Does that feel better?
Yeah.
Okay.
Okay, I guess I'm gonna watch this video about the nurses who train to give people insulin. I hope it's good.
Hi, welcome to insulin training for nurses. Today I'm going to be talking about regular insulin, which is also called Humulin or Novolin, and the generic name is just regular insulin. So today I'm going to be talking with some nurses, and they're going to be instructing us of how to use insulin and manage better glucose control. So first off, I'm going to start off by talking about the mechanism of action. In your body, a regular person has a pancreas that secretes insulin, and that helps control and bring down your glucose levels. Without insulin, you would not be able to get glucose into the cell, and therefore you would become hyperglycemic. So it's important to make sure you check your glucose levels, and if you do show signs or blood glucose levels below 70 milligrams per deciliter, then should avoid taking insulin. So some contraindications as a nurse you should take into consideration is being hypoglycemic. So if you have a level around or this range 62 or below 70, if you do have a hypersensitivity such as an allergic reaction, you should avoid insulin. So now we're gonna go off and find our nurses and talk more about insulin.
I'm Nurse Shannon, and we're going to talk today about checking your blood sugar and administering insulin and managing your diabetes. So when you check your blood sugar as a diabetic, most often you're going to be in a hyperglycemic state because of the course of the disease. So when you find yourself with a blood sugar like this, hopefully not this high, anything above 130 is considered hyperglycemic, but this is an example of a hyperglycemic reading. You will need to administer the appropriate amount of units of insulin.
I'm Nurse Jana. After checking your blood glucose, you will want to draw the appropriate amount of insulin according to the slide scale. After doing this, you will want to check it with the nurse to make sure that you have the correct amount. Good. Thank you, Shannon. Now that you've double-checked your insulin with the nurse, you can inject the insulin. The preferred site is the abdomen due to the slow rate of absorption. You can also inject it to the arm or the thigh. Here, we'll do it in the abdomen. After this, you're going to want to check your blood glucose again. This time, we're hoping for a much better level. And here we are.
A blood glucose of this reading would tell you that your blood sugar is now normal, because a normal range is anywhere between 70 and 130.
Make sure you administer your insulin 15 minutes before your meal. The peak onset is 30 to 60 minutes later, and it lasts 3 to 5 hours. The next thing we're going to talk about is adverse effects. Some people have allergic reactions to insulin. Also, if you inject too much insulin, you can become hypoglycemic. You'll become very cool and clammy and not feel well at all.
Additionally to that, we're also going to talk about drug-to-drug interactions. There are quite a few drugs that interact with insulin and some of the other diabetic medications. So you always want to check with your doctor regarding anything you're taking, but especially make certain that you check with him regarding taking any cortisone drugs, any diuretics, propranolol for your heart, and drinking any alcohol, as any of those can either severely increase or decrease your blood sugar levels and can cause severe complications. And additionally, if you take any herbal supplements that are over the counter, any garlic, any ginkgo biloba, those will also affect your blood sugar, and that you need to follow up with your doctor about taking those along with your insulin medications. So did you finish watching the video?
I did, and actually I feel a lot better. I'm really, really eager to learn all of the things about insulin.
Great, so now maybe we can just go over it together?
That sounds like a great plan.
Fabulous.
Okay, Mike and Ike. Oh, go ahead. Hello, is this Miss Ike?
Yes, Mike and Ike, that's me.
Mike and Ike, okay.
Okay. So now we're going to talk about some adverse effects of insulin administration.
Hyperactivity being one of them. Sorry.
Human balls.
Happen is administering too much. Are you filming?
No. I thought we were practicing.
He's filming!
Sorry.
Human balls is hungry.
Human balls need some candy.
Needs some.
Mike and Ike need some candy. You're better than the doctor.
Thank you.
Okay.
We try.
Yeah, I know.